Good morning, YouTube. I'm on my way to work. It is June 10th, the day after I did my x-ray, so I haven't heard anything back. But I was just driving to work. I'm kind of sitting in traffic here, and I was just thinking how I could explain to some of my friends or family that ask me what the surgery is like. And the two things that I equate it to, one I kind of talked about before about being pregnant, and it really does kind of work out to where it's like that. When you first start thinking about maybe having a baby and you're excited and kind of scared and you question it and you're like, is that a right thing for my life? You know, would I be a good parent? How is it going to fit into my life? How is it going to change my life? Can I afford it? I know it's a lot of work. Is that something that I can do? Is it something that I want to do? And you think about all those things, and it's a lot like starting to think about if you want to have bariatric surgery. Can I afford it? Is it something that I can do for the rest of my life? Would I be good at it? Would I be able to stick to what I need to do? And you don't really tell anybody, and you just kind of think about it in your head. And you don't want to make it, you don't want to fantasize about it and just go, oh, a baby, how wonderful, you know, because you want to be realistic, and you go, okay, I know there's going to be a lot of work, and it's going to be, you know, it's a child, it's a person that you're bringing into the world, not just a cute little baby. And the same thing about surgery. You don't want to go, oh, surgery, I'm going to lose all my weight, and it's going to be easy, and it'll be fast, and I'll do it, and it'll be great. I mean, you have to be realistic about it. So it's a lot like pregnancy. And then, you know, you kind of start to call your insurance company and you look for a surgeon and you see what, you know, if you qualify with your doctor, and you kind of start going through the hoops. And I guess that would be like talking to your husband about it and talking to your family about it and seeing if it's something that you guys want to do. And you're kind of starting to get excited and you do your research, and then the more hoops you go through, and if all the doors are open, then you get pregnant. And if all the doors are open and you jump all through the hoops, then you get your surgery date. And nobody knows. I mean, people that you don't choose to tell, they don't know that you're pregnant. They don't know that anything is different going on inside of you. But you know, there's a lot changing inside of you. You're thinking about, you know, what you're eating and why you're eating it, and you're getting ready to make a huge life change. You know it's coming. You know it's gonna affect everything, and you're reading everything you can read about it. You're watching everything on YouTube. You're taking pregnancy tests. You're doing, I mean, you're kind of preparing your health, taking vitamins. You're doing all kinds of stuff, and then comes the day of surgery. And then comes the day that the baby comes. And it's really painful, but you know it's for a reason, and you get through it, and you recover, and you know that it's worth it. And it's just, and then the rest of your life, you have like the greatest joys that you'll ever have. And it's the hardest job you'll ever do. Losing weight and continuing to maintain it and to work out, and watching what you eat and getting in your protein. It's like raising a baby. Like, you just have to be constant. You have to be vigilant. You have to do it right. You have to, you know, put a lot of effort into it. But it's probably the most rewarding thing that you can do. And the same thing with being a parent. So I equate it to that a lot. And the other thing I was thinking of, and some of you may get this, some of you may not, but I'm a Christian, and one of the things a couple years ago that the Lord really kind of impressed on my heart was that I need to watch my speed when I'm driving, because one, it's against the law, and it's not safe. And most of the time, I mean, I wasn't like a huge speeder, and I don't have road rage or anything, but it was just something that He just told me about. And so I thought, for me, the best way to do it would be just go on cruise control for the most part, because most of the time I'm driving, I'm on the freeway, and it's a long stretch. And I don't speed usually on purpose. Once in a while when I'm going to work and late or something, but normally it just creeps up on me and I don't even realize it. And it was the same thing with food. Like, sometimes I knew that, okay, you're being ridiculous. Like, there's no reason you need to eat all this cookie dough, you know? But sometimes, most of the time, it wasn't something that I was cognizant of. It was creeping up on me, my weight and what I was eating and how I was eating and when and why, and it was creeping up on me. And so anyways, so back to the cruise control thing, I thought, okay, if I put myself on cruise control, then it won't creep up on me and I won't be able to help it. It didn't take me very long before I realized on cruise control on the freeway going 65 that I had to put myself in the slow lane and that people were just whizzing by me. And I knew that I was being obedient and that I was being safe and I was doing what I was told to do. You know, I was doing what the Lord really told me to do. But it was still kind of hard. In the beginning, I would look over at people and go, why are they allowed to speed? You know, that's not fair, Lord. Why aren't you just telling them just, you know? And then sometimes I'd look over at them and I'd feel sorry for them. And I'd be like, you know what? They are being so dangerous, and why don't they realize what they're doing? And they could get in an accident, and they could kill someone just to get there faster, and it's not worth it. So I'd go through all these different phases. And this was like 2 or 3 years ago that I've been doing this. And it's really funny. Sometimes I'd be going cruise control 65, and there would be somebody that whizzes past me. And then in a couple minutes, I'd be whizzing past them. And I'm going, why in the world? Like, I'm on cruise control. I don't know what you guys are doing. And no traffic or anything. And then all of a sudden, a couple minutes later, they'd be whizzing by me again. And they were just so inconsistent. And I would equate that to other people going on crash diets and losing a whole bunch of weight. And you kind of look at them and you just go, oh, I wish I could do that. And then 6 months later, there's all their weight back. And you have been slow and steady this whole time, which is better, you know, a healthier way to do it. And so a lot of times now, I don't even, since I've been doing it for a couple years, sometimes I find myself going 65 and I'm not even on cruise control. And that's what makes me really happy, is that I've retrained my habits, that if I go past 65, I don't feel right. I feel like I'm going faster. And I guess that's the same thing as training your appetite. I want to eat healthy all the time. I want it to feel natural. If I eat too much, I want to feel that full feeling, and I want to know that I'm eating too much. And I don't want to compare myself to what anybody else can eat. You know what? If we go out and somebody else can eat 2 plates of food at Olive Garden and they're as skinny as a rail, I don't want to have to look at them and be jealous. I don't want to judge them. I just want to be focused on what I'm doing. The Lord called me to be healthy and to watch my weight and my health. And if other people can do other things, that's fine. I don't want to judge them. I don't want to envy them. I just want to be slow and steady and stay in my lane. And cruise control to me is kind of like the surgery. It's supposed to retrain. I want it to retrain my brain. I want it to kind of get me back to normal. And eventually, I won't be using it as a crutch so much. And then if I'm eating the right way, it will feel normal to me. And then if I'm not eating, and if I go upset to 70 or 75, I'll recognize it just naturally instead of not being on cruise control. Does that make sense, or am I really overthinking this? Anyways, I just was driving to work and thinking about, you know, being on cruise control, and it took a couple years, you know, for it to be natural for me to go 65. But you know what? In the long run, I know I'm being safe. I know I'm being obedient. I know I'm following the law. And there's been so many times in the last couple months or years that I've been doing this, that police will go by, or I'll you know, pass a policeman that's sitting there looking for people with radar. And I don't have to think about it, because I don't have to feel guilty. I don't have to go, ooh, I'm so glad he didn't see me. Like, I'm being safe. I'm following the law. I'm doing the right thing. So that alone on my conscience is better. Plus, my son, when he turned 18, he just turned 21 the other day, so this was several years ago. And this may be why I started with the speed control thing. He flipped, it didn't really have anything to do with speed, but he flipped his truck on the freeway about 3 times and landed on a fence in the opposite direction, on the top of the fence. And he had his 2 best friends in the car at the time, and praise the Lord, none of them, they all walked away. They were all wearing their seatbelts, and they all walked away. And the people, the firemen and the paramedics that got there said that they had there was no reason. They had no idea. They'd never seen anybody walk away from something like that before. And so I know God was protecting them for whatever reason. He was protecting them. And I used to be a trauma counselor, and so I've seen a lot of death and destruction in car accidents and texting and just anything. It's just so dangerous and unhealthy. And it's preventable. It's the same thing like dying from obesity complications. Like, it's preventable. Slow down. Don't text. It's preventable. Like, get some help with your weight and with your health, because to take yourself away from your family and your friends because you were texting a text message to somebody, or because you were speeding, and the same thing with weight, to take yourself away and die too young because you had health problems from being overweight, it's just not worth it, people. Like, life is precious, and anything that you can do that's avoidable, anything you can do with your health and just do on purpose to stay healthy and to stay safe, you got to do it. And that's what I'm doing. I feel like I'm taking control back of my life and trying to stay safe. So besides the fact that, it would be fun to shop for a smaller size of clothes and all, there's a lot of pluses, there's a lot of positives, but getting rid of high blood pressure and cholesterol and keeping my heart healthy and being alive for my kids is it's more important than anything else, especially more important than speeding and using a text message or something like that. So I don't know, I'm way overthinking things now, but they're just some things that I was thinking about. Life is short, and I want to enjoy my life, and I want to be healthy, and I want to be there for my kids. So that's just what I've been thinking today, and I'm at work now. I guess there's nothing else to update you with. My stats will be down in the comment bar. Yeah, that's it. Thanks, YouTube.